Brydges, holds the professorship in technology-enabled education and is the Director of Medical Education Scholarship at the Department of Medicine, Unity Health Toronto, and the University of Toronto. He's also the Director of Applied Education Research Operatives, pronounced AERO, that's a cool acronym, research group at Unity Health Toronto. His research focuses on how healthcare trainees, professionals, and the teams they form engage with various modes of self-regulated learning. He also tests the claims that current training prepares professionals for their future lifelong learning. He currently supervises many PhD students and medical residents who help shape and challenge his thinking daily. With great pleasure, I will hand over to Dr. Ryan Brydges.
Thank you, Petal, and thank you everyone for coming. I think no matter the size, you're almighty, so I'm glad to have you here and to talk through these ideas with you. And they are, as you'll see, primarily ideas at the moment. We're doing some research on this topic, but just building it out and getting things going in the pandemic. It's been a little slowed, but yeah, I'm hoping I can present the thoughts, get your feedback. I have some discussion sections built in for you all to interact. So sorry if you thought I would just talk at you for an hour here at the end of the day, but I do want to hear from you as well. So really hoping you have the opportunity, many of you may be driving or what have you, but the opportunity to unmute and join the conversation too. So just going to load up the slides here. So again, for those of you who don't know me, my name is Ryan. The slides are showing, right? Prepared to learn, you see that? Yeah? Okay, just double checking. I'm at Unity Health, St. Michael's specifically, and also at the Department of Medicine. And so this idea of how prepared we are to learn, how ready we are for our future, I think is something that some of us probably think about, but we're all so busy on the day-to-day that we may not think about how prepared we are for all the things that are going to change in the future. And I have a quote from Dave Sackett that I really like, who said to a medical student, I think it was during a graduation ceremony, that half of what you've just learned is going to be obsolete in 2 to 3 years. And the problem is you don't know which half. And so what's most important is that you learn to learn, not just learn as though learning is done by the time you get some kind of certification or licensure. And I really like that because I am a self-regulated learning researcher, and I believe in an ongoing approach to and the challenges that are associated with engaging in lifelong learning. Just slide ahead here. And so just if you want to put into the chat or even like raise your hands briefly in response to this, I'm curious, would you say that you learn the way you do because someone taught you to learn that way? And why don't we use the chat? Yes or no? Did someone teach you to learn the way you do? Some no's. Yeah, how to learn. Trial and error, no. So most people are saying no. Okay. And mixed, maybe some say yes, but generally speaking, no one really taught you that. And that's a common experience. The researchers who I follow who asked this question asked this of psychology students, and 80% of them said, no, no one's taught me to get where I am today. You learn by trial and error in a lot of ways, as someone noted. And so I wonder about this question then. How often have you been assessed on how well you learn? Not the extent to which you have learned something, but how well you learned it. And if anyone has a yes on that, any example? How did that happen for you? So seeing some nevers. And does anyone have an example and feel comfortable sharing off mute or putting themselves off mute of how you have been assessed on how well you have learned? I'll wait my customary 7 seconds. So it seems like, yeah, not since exams, but even on exams, was it how well you learn as a learner or how well you have learned the material?
Learn the material.
Okay. So here we are.
Got it.
Oh, please.
Hi, it's Alex here.
Hey.
If I think for myself, it would be when I became a member of the motivational interviewing network of trainers. That would probably be the last time that I was kind of assessed, and that would be in 2014.
There we go. So long time. And
Yeah.
I see Sharon has also raised her hand. Thank you, Alex. Sharon, please.
Yeah, I don't know, like maybe this, and I don't know in what context this was, but I think I once remember completing some type of like questionnaire on how I learn or what methods I learn best, I think, but not like assessed on how I learn, just the types of ways that I learn best. I seem to remember that in some sort of lifetime ago.
Okay. And thank you for sharing that. And I kind of love because I have the same like vague, did I? Maybe it happened. And yet, you know, many of us here are in health professions or study health professions as I do. And isn't the mantra in most of them that we're all learners, we're all teachers, like lifelong learning is a commitment, and so on and so forth. So that kind of statement is there, but the commitment to generating data and generating that ongoing experience of attending to how well we are doing as learners, I think is not there. So why is that disconnect happening? And so, yeah, I leave this question up just or as a closer here, just to say, well, how prepared are trainees to learn the healthcare of the future? And I think we might say, and I've had people say, well, I mean, healthcare isn't falling apart, so obviously we figure it out. And my answer is, yeah, but we could probably optimize that. And so, you know, by checking in on and understanding and thinking about how we teach about lifelong learning and self-regulation of learning, I think we have some gains to be made. Are they going to gain us like a new healthcare system that's far more excellent than it is? Perhaps not, but is that the goal? I think any kind of improvement is improvement nonetheless. And so how prepared are we? Unfortunately, I've stumbled upon through colleagues of mine this idea of preparation for future learning and started to integrate it into my work. So this comes from the educational psychology world and is defined as the ability to learn new information by making effective use of resources and potentially inventing new ways to support our learning and problem solving in practice. So a lot of people talk about this as interpretive knowing. Like, I know there's a problem. I don't know exactly what the solution is, but I'll adapt myself to be able to generate some kind of approach. And oh, shoot, that means I have to learn a little bit. Okay, I'll go and find resources, whether it's people, online resources, whatever it may be, to support me in helping to address this particular problem. And so this gets us thinking about assessment. It gets us thinking about training differently. And it fits into a general class of assessment called dynamic assessment. And PFL, again, I'll refer to its preparation for future learning. So when I say PFL or PFLA, I mean preparation for future learning assessment. And the general model of PFL, this kind of assessment, is that you have two groups that you're comparing. And let's say it's one group doing it the usual way, A, and then another group doing it the new way that you're experimenting with, intervention B. Well, you put them through an initial assessment after they've done their learning experience. That's what we traditionally do. That's like a post-test, immediate post-test assessment of performance, of skill, of knowledge, whatever it may be. What PFL gets us to do is to introduce two additional steps. First is a new learning resource. So both groups then get exposed to a new learning opportunity, a new situation that's related to, but not the exact same as what they experienced during their intervention. And you look to see how they learn to learn in that new setting and then perform on a subsequent assessment that's relevant to that new resource. And so the idea is that it's called a double transfer design. You're going to transfer in the knowledge and the abilities, the learning, strategic learning approaches that you were using in your first intervention, transfer those into the new learning resource and how you learn there. And then you transfer out from that experience to the penultimate assessment, which again is this PFLA. So that's the double transfer. And we often really just study this immediate performance improvement rather than thinking about how people are doing what essentially we are always doing in education, right? I trained you in this setting. Often it's not quite your practice setting. Are you going to be able to transfer in all of your prior knowledge and all of the work experience you've had to date to learn this new material? And then go out into your practice and solve similar but often different enough problems where you'll have to create different approaches and different solutions with this new knowledge. So to me, this is kind of actually what happens in workplace-based education and education that's relevant to the workplace. But we don't necessarily study it that way. We often stop, again, like I'm saying, here in research practices, and I think in our own assessments as we're talking about. And of course, MCQ. Okay, you got 90%, you're good to go. So fortunately, there has been some good research that establishes what kind of instruction supports PFL. So that too, the intervention A versus B, these are the B interventions. So there's literature on this idea of problem solving first, followed by instruction, which is the opposite of what we typically do, which is instruction first, and then some practice problems or practice on the simulator kind of experiences second. Productive struggle, which is a version of that that I encourage you all to read up on. And then integrated instruction, colleagues at the Wilson Center, Maria Malopoulos and Nikki Woods, have shown that this approach to integrated instruction, taking different ways of thinking about a problem and integrating them together, that can also lead to improvements in these preparation for future learning types of assessments. I think there's a black box here, though, that we haven't quite addressed. Those colleagues who have shown PFL instruction works have really just shown that the groups in intervention B perform better than intervention A on the preparation for future learning assessment. I want to know what they're doing. What are they doing? What have they learned to transfer in? What kind of strategies are they adopting? How are they engaging with the learning material? And for me, that's where theories and evidence associated with self-regulated learning comes in really well. And don't worry, for those of you who are like, isn't this a simulation talk? Simulation is going to come, I promise. But I wanted to give you this basis of like, why do I think in a particular way about this problem? So what do I mean by self-regulated learning? I haven't quite defined that yet. For me, it's learners controlling their metacognitive, meaning how they think about their own thinking. Am I doing well? Do I need to change things up? Their cognitive and behavioral. So what am I doing? How am I doing in this particular moment? And what am I trying to do? And motivational and emotional states through iterative processes of planning what they want to do, setting goals, monitoring if they're accomplishing the goals, evaluating if they actually met what they want to do, and then adapting if need be, if things aren't really working well. So a lot of this thought gets placed in the individual. Is the individual developing these skills? Are they self-regulating effectively? And I have found in health professions education and in simulation settings as well, as I'll talk about, we really treat this as like a lone venture. It's like, do it yourself. We won't check in on you. You're clearly an adult learner doing well already, so keep doing what you're doing. Like we've talked about, no one's assessing this or helping us think about it in terms of how we are as learners or how we do on an exam or focused on our learning skills. And so this is a claim that I think we all propagate. Well, we've selected all of these adult learners, or we ourselves as professionals are adult learners. And so we can all self-regulate our own learning effectively. And so we don't need to measure it to know that it's happening. Things clearly are working well enough. But we've done some literature reviews, and we're actually updating this one. This is from 2015. But basically, we found here that self-regulated learning entirely on your own, can be just as effective as learning with an instructor. And so people are doing it well, but we don't know why or how, was kind of the lesson here. And we also found that people aren't supporting it. And there's evidence from other fields. This is educational psychology. An older paper, 2005, but many papers establish this, that if you support self-regulated learning in some kind of meaningful way or test it and then provide people feedback on how to do better, that can actually be very beneficial for their future learning and for their learning outcomes in general. And so I just want to pause there. I think this black box of like, how do we think about lifelong learning? How can we apply this model of assessment and these ways of training people? As you might imagine, I'm going to get into saying simulation is a place where we can do a lot of this. But I just want to stop here for a moment and check in on thoughts so far. Has this been clear? Are there any questions? Is there anywhere that I'm not making sense or that you'd love to probe more? I just want to check in with the group. So please take some moments, think through, and either, come off mute or please type in the chat. Yes, please.
Hey, Ryan, it's
Yeah.
John Rizos. Can you hear me?
John, yeah, I can.
Yeah, I'm at Credit Valley in Mississauga. Interesting the part about self-regulation and using tools to determine whether one is on track. Thinking about your thinking and the process is fundamental to this, and you emphasize that it can be done on your own. So other than checking in with a mentor, supervisor, how do you do it on your own? What are some of the signposts for that? I think I do it, but I may be off base.
Yeah, great question. And I'll go one direction. I think we need to build experiences. So a lot of research has shown just trying to teach people like you just got to set goals and do this and that that's not effective. It's about giving people experiences and problems that are slightly beyond their scope or experience and seeing how they work through them and showing them that you can work through them. And part of working through them is asking for help and collaborating with your supervisor or more experienced colleagues or your peers. And so part of it is, do we regularly consider how we are doing as learners? Do we set goals as professionals? Like this year, I want to submit a grant in October. Like that's been my goal all year. If I don't submit that grant, I'm going to be pretty disappointed. So what do I need to do that? What team do I need to rally around me? Who do I need to ask for help to support me in doing that? I think we can all set these goals and then monitor how well we are doing those or working toward them, what strategies we're using and so on. But again, if we're thinking about building it into a curriculum or seeing it in those who are mentoring or being mentored by, I think we can also have these conversations about, are you doing this? How are you doing it? And then giving people challenging tasks to see how they work through it and the experiences that they generate for themselves. Rather than telling them how to self-regulate, just let them self-regulate and see how it goes. But be there to support them along the way, or to put people around you who support you along the way. I hope that answers part of the question.
That is helpful. And it sounds like it's in the same vein as opposed to giving a person a fish, showing them how to fish, feeds them for a long time. It's, we can get to individual problems. However, if we don't understand and have a methodical process we use, once it's out of our pattern recognition armamentarium, that's where you get a little overwhelmed, a little anxious, and things can go south in those circumstances. So having an idea of how to address these in a generic way, I think would be very helpful.
Mm-hmm. Thank you. Yeah, we're working now on trying to understand the networks people build around them to enable them to engage in these activities regularly. And this talk is, we could be doing that formally in the curriculum and helping people understand there's benefits to doing this on your own and to building groups or communities that you do this with. Megan, love to hear your thoughts, please.
Hi, Ryan. Thank you. Yeah, so the term preparation for future learning, it's a new term to me, but the concept isn't new, right? It's something that we talk about doing in health professions education all the time, or that we want to be doing. Mm-hmm. And I'm thinking as you're talking that there's maybe some parallels to adaptive expertise, but I wanted to know what you thought about that. Like, if I'm Do you think those two things intersect? And if so, how? And
Yeah,
or I'm just
absolutely.
maybe off base.
No, you're directly on base. So the person, one of the authors of PFL, Schwartz, Maria Malopoulos, who studies adaptive expertise, and I wrote a paper with him about the clear links. Adaptive expertise very much is this idea of utilizing these resources, being able to see the world in unique ways, innovate where possible, use your routines where possible, be open to both. And PFL as an assessment kind of paradigm is meant to capture that. So they're very much paired together, actually. And the way I see adaptive expertise, where it's lacking a little bit, is the description of self-regulation. It's a facet of adaptive expertise, self-regulation, but it's not kind of elaborated and fully understood and layered out as to like, what does it look like? How do we know when people are engaging in this effective self-regulation? And there's lots of theories for that. That's what I study. But yeah, that's a clear connection that you're making there. Well done.
Okay, that's helpful. I'm gonna go find that paper. Thank you.
Thank you. And I saw Sharon, you had your hand up, but you may not anymore, so that's okay. I can move on, but just giving you the opportunity, or anyone else for that matter. Okay, well, let's transition. I do have other spots for us to converse. Hopefully, you're all invited. So the next idea is, yeah, I've said there's this black box. We prepared people through their interventions in some way in that initial learning experience. We bring them back to learn with this new learning resource. What's going on in there and how might we study it and understand that? And if we're education minded and practical, how do we build this into the curriculum effectively? And so I do think that black box can be opened up, or at least addressed a little bit, wrapped around with simulation amongst many other different approaches. But being a sim person, I feel like this is a really great setting because people can go off and struggle. We can put tasks in front of them that they're not going to get right. It's safe for them to do that, and so on. All the reasons why many of us use simulation. Now, will it like perfectly unlock the box? Well, I think that's the claim. To your point, Megan, I think some people are like, well, doesn't sim already do this? Like, we're preparing people practice in sim and then they transfer what they learned into their practice, don't they? And I think that might be right for the skill at hand, right? Like the mastery approaches to teaching a procedural skill, like thoracentesis, may really prepare people to be really great at thoracentesis. But does it prepare them to be really great as learners of the next procedure, or innovators of how to do thoracentesis in this really challenging patient, for example? I'm not so sure. And so this is something that I think we can stress test simulation a little bit with, this idea of, are we really preparing people for their future in the ways that we propose? And also layering in these more potentially complicated ways of thinking about education, but complication hopefully is fruitful. And just seeing Sharon's question. So the question I had is how we balance this with learners who just care about marks. They don't realize the value of knowing how to learn and just want shortcuts and all the answers. Oh yeah, that is challenging. And that's why I think we need to build this into our curricula, these kinds of assessments more regularly, so that people are signaled to know and to value, and know that we value the process of learning just as much as the outcome of learning. And if we just give, okay, you got 94, see ya. If we just continue to propagate that notion of what learning is for and what the assessment feedback you get is leaning you toward, I don't think we're challenging that expectation that learning is outcome, learning is doing, rather than learning is learning is completing, I should say, not learning is doing and processing and engaging with ideas in varying ways. And so, yeah, I wanted to challenge us as a sim community to say, like, are we really doing this? Yes, we might be preparing people to do the task, but are we also preparing them to be learners in the clinical setting? Or are we kind of closing that off and saying, you're a master of this, you don't have any more learning to do? And that's somewhat counterproductive to this idea of preparation for future learning and lifelong learning. And so what messages are we sending with our different approaches to assessment and training? And so this is the in-progress study. I have a study idea that was funded, fortunately, by SSHRC. So that's the Social Sciences and Humanities Research Council here in Canada. I had a great team supporting it and continue to have a great team. So many of them listed here and many from our community you'll recognize. I want to point out Adam Gavarkovs, who's a PhD student working with me, Emer Finen, who is also a PhD student, and Jen Waju, a postdoctoral fellow, all helping us work on this project. And we called it Toward Valid Assessments of Self-Regulated Learning from Classroom to Workplace, because SSHRC doesn't really understand simulation in healthcare. The classroom is the simulation center in this particular case for this community that gets that place. Okay, so here's the general study design, and there's a lot going on, so I'm going to just slowly talk us through it. But basically, our intervention B, what we are testing here, is this idea of problem solving first. So once again, how does simulation typically unfold? In my experience, we bring in an expert, they do a demonstration, or there's an expert team who does a scenario to demonstrate the optimal communication pattern or approach to communication or teamwork. And then we tell people, okay, now it's your turn, go ahead and practice. And so much of the literature has challenged that in educational psychology to say, there's not usually someone beside you giving you a demo every day you come to work. You need to figure it out. And if we're preparing people for that reality of you need to figure it out, and then if you need help, go talk to someone, then perhaps doing the opposite sequence will be beneficial. And there's a pretty good amount of evidence to support that. So problem solving first, where people struggle, frankly, sometimes people call it failure. I've learned in healthcare, don't call it failure, call it struggle or challenge. And productive struggle is the term that's used. So we're going to have people come into the sim center, they're medical students, they're learning thoracentesis. That's why I keep saying thoracentesis, partly because Kieran McIntyre, who's one of the partners, has a clinic, and we're going to end up in that clinic with some of these participants to study how well we prepare them for the future learning in the workplace. Yeah, there are going to be these medical students coming in, learning simulated thoracentesis. And at first, they're just going to be told, this patient needs a thoracentesis. You need to produce a safe procedure that doesn't lead to an infection, where you get a sample to send out to the lab to help with the diagnosis for this patient. And that's it. And they're going to have equipment. They're going to have a simulator that if done correctly, they can withdraw fluid from, and they are going to have an hour to interact in that setting. Some will get increasingly frustrated. Some will be incredibly innovative and experimental with their approaches. We're intrigued to see all those approaches. So we're going to study their thoughts, their behaviors, the artifacts, the notes that they create as they work through this. There's going to be then an instruction second component here, where an instructor comes into the space and works with them to talk through what they tried, where they've had difficulties, and teaches them to perform a safe, uncomplicated thoracentesis. And that'll take about an hour. Once again, we're going to look at what they discuss, what they think about, what they do, how many times they go through the procedure, what equipment they use or don't use, and so on. And then we'll have the opposite sequence. So it's a trial where there's an RCT and students are randomized to either condition. So that's that initial learning experience. And then we have 2 preparation for future learning assessments. And you may ask, well, why 2? And the reason that we have 2 here is because we're testing them against each other. These are resource-intensive experiences. And many of you, if you're similar to colleagues who I've talked to in the past, might say, Ryan, we don't have room to do this kind of assessment in the curriculum. So that's why we don't do more assessment of lifelong learning or training of lifelong learning. And so we're actually trying to see what is a least resource-intensive approach to doing this kind of assessment. So again, people go through the training. This is about 2 hours in the simulation environment, 2 hours because that's usually how much time is dedicated to a procedural skills training experience. And then they're going to do 2 types of PFLs. I'll explain each. Embedded resource, this is a case-based one. So we've generated cases, and there's 7 cases per assessment. And the first case tells people how to solve the problem. There's a patient, they need thoracentesis. There's a what and a why. What would you do and why would you do it that way? And we provide that completed case for them. And then the remainder of the cases do not have any kind of information provided. And so the resource is what they're learning from. Can I access that resource? Do I learn about what and why? Do I learn what and why for that case and how I might apply that way of thinking to the additional cases? And so that's what they learn from. And then they perform the remaining cases. They fill in the answers, and that's their test score that we're going to generate. So it's case-based. They're going to be writing answers, and then we have someone score those answers eventually. So that's one approach. Pretty resource medium, I would say. The other is what we would typically see, called learn then perform. And here we give them a booklet of 5 fully explained cases of thoracentesis, different kinds of cases you might experience in the clinical environment that are different from what you've just learned, which is the uncomplicated approach. And we give them the booklet, we give them a highlighter and a pen, and we say, study this booklet, it's relevant to you in your future practice. And then as they finish the booklet, we're going to give them half an hour at most, but some may finish early. We tell them, actually, one of those patients is in the next room and we need you to perform the procedure on them. And it's going to be the simulator. And the idea is, did they read those cases well? Did they prepare to perform on any of those cases? And will we see how well they perform based on that prior learning by actually having them perform the procedure on the simulated patient? So again, we're going to look at how the things they're thinking, the artifacts, what they highlight, the notes they take, that kind of thing. So now we built a full sim experience where we are preparing them for future learning, we think, through our intervention. And we are assessing that using 2 different approaches, a sim-based, performance-based approach, and a case-based, more knowledge-based written approach. And then finally, just to round this out, it's a big study. We're going to bring some of them back to the workplace, and we'll have another embedded resource assessment similar to the one I just described 2 weeks later. So we're going to see, do they have retention of knowledge? Can they transfer to slightly different cases that are more workplace related in the same kind of assessment? And then some of them will actually work with Kieran McIntyre at St. Michael's Hospital and Harvey Wong at Sunnybrook to go to their procedures clinic and actually embed themselves on the team. They won't be performing the procedure, but we're going to give them an iPad. We're going to look at what they look up, what notes they take, how they interact with their team members to see how well these different experiences prepared them for the reality of being part of a team in a workplace doing procedures on real patients. And so to round this out, I'll just describe how we are breaking this up in terms of kind of scholarly units or what we're reporting on as a result of all of this work. First this is a randomized controlled trial, 2 arms, problem solving first or instruction first, and then the experience of the alternate sequence. These 2 assessments, how well do people perform on them? That's the first study question. The next one is actually a validation study. So which of these assessments is most sensitive to the intervention, and which of them relate to the workplace related assessment that we've also created? And we're creating a validation study around this and looking to support this approach to assessment through data. And then finally, my squiggly line, this is our SRL case study. So I'm going to take each individual who goes through all of these experiences and study them as an individual. How did they engage with the problem? Are they the type of person who got confused and frustrated and kind of gave up? Because that's normal sometimes for struggle, not a critique. Or are they the type of person who was like, you know what, I'm going to look inside the simulator, I'm going to move it around. They didn't tell me I couldn't do anything. We're going to let them do whatever they want. And they'll start to understand how things work and potentially experiment and learn differently. Well, that's going to set them off on a different trajectory, those 2 types of kind of polar opposites and all that falls in between. So we're going to study that kind of pathway, that journey that they engage in from event to event. And that's why I've kind of represented these as different boxes. There's 6 events that they can experience, and we can study how they approach their learning through all of those by collecting a lot of data and observing what they do and talking to them is our plan. So overall, the key implications of this particular work is that we want to compare how these two preparation for future learning assessment designs function as outcomes of simulation-based training and as predictors of workplace-based learning, what people do when they get into the clinic. This hopefully will advance theoretical links between PFL, to Megan's point, at the notions of adaptive expertise and self-regulated learning. And then we want to mobilize this into actual ways to create these kinds of assessments. And we've been cataloging everything that we're doing because right now we're working with respirologists who care about thoracentesis, but we want to turn this into anyone who cares about creating lifelong learning assessments in their particular practice area. And so we've been creating a blueprint for how to do that as well. And actually, I'm just going to pause there and put up maybe not the crazy one, maybe this one for now. And just see any questions, any thoughts, any places where you're confused. Does this resonate? I know it's a lot of information at once, but an application of the prior conceptual points I've been making to this point. So, and would love to hear anyone's thoughts or questions right now, please.
Sorry, I'm going to ask a really stupid question because maybe I
Never.
missed this, but no, I'm just actually trying to conceptually understand. So are these like two arms of a study, like the top row, bottom row? Or is this like, I understand the squiggly lines, they go through all of that, but how did you break this up? Like, that's what I'm a little confused about. Sorry.
Yeah, no, please don't be at all, because there's a lot of moving parts. I get it. So yes, everyone is going to go through. There's going to be half the group that goes through it this way, problem solving, then instruction, then all the assessments that follow. There's another group, I should put a different squiggly line in a different color. The comparison will be going the opposite, from instruction to problem solving, and then these assessments. And so really we're looking at how this early experience sets the stage for everything else. And the point is, this is really what we do. We go this way, always, instruction first. And by just changing the sequence, changing the way we spend the hour and the order in which we spend those couple of hours, we may change the entire trajectory that people go on to engage in lifelong learning after that event. And that's kind of, again, not kind of, that is the point. We often just stop here and say, okay, great, this group did better than that group, we're done. But we are saying, no, we're actually setting people on a path, and let's study that path over time across the simulation environment, and particularly how well this simulation experience is preparing people for their actual workplace experience.
Thank you.
And this is complicated. Like, I acknowledge that again, but at the same time, it doesn't have to be. This is an example of how simulation can be used to give people a little bit of struggle, let them come up with their own questions, let them come up with their own approaches, and then teach them, rather than, again, the opposite of we teach them and then they just start doing exactly what we taught them. Well, maybe in the real world, they're not going to have that equipment, or they're not going to have access to a person directly by their side, and so on. And so that idea of learning where you struggle, learning how you make meaning, can be very beneficial. So this can be adapted to any kind of sim experience as we think about how we use sim to actually prepare people for future learning. So
And
thank
are
you
they
for
getting-
focusing on that. That was not a dumb question. That was a great
Okay.
question, in my
And
opinion.
then, do they get feedback in the assessment and the oranges and the purples, or are they just doing it? You guys are recording what they're doing it, and then just
Yeah.
because that
Yeah, for
feedback-
research purposes, we are, you know what, we'll probably give them feedback, actually. We're about to run this, we're piloting. I think we will give them the data. The problem is the data take a little while to generate, right? Like, someone has to score this like written document and score this video of them performing before they can get the data. So that usually takes a little while. But yeah, we will, in the moment, give them a sense of some of the things, like the instructor is hanging around until this point, and when everyone goes home, so the instructor can give them some pointers at the end. But yeah, in the real world practice, to your point, we'd want to give people feedback as soon as possible, of course.
Thanks.
Thank you. Oh no, Lisa. I know Lisa really well.
Hi, Ryan. How are you? Good to see you. And sorry I got a little bit late on this meeting, but I just wondered, I didn't catch all of the beginning portions of the research. However, I just wondered if it seems really interesting, moving forward, research and questions. Is there anything similar that you've used that's currently out there that you're basing this research on, that they've had outcomes already that you're going to compare to?
Yeah, thank you. So, this one, because it's source synthesis and it's a new way of assessing it, we are creating everything from scratch. So that's why I said, like, we're creating kind of a playbook for educators. But there are other studies, yes. And I haven't listed all of them in this, of course. But here's one where we talk about it to a degree in this paper that's about licensure exams and how we can embed self-regulated learning and preparation for future learning into, we didn't write it like it's a simulation audience, but it's simulation. These are like performance-based exams. So this one's about that. And then there are other papers, and I can share some links as we go along today, from Maria Malopoulos and myself. And sometimes we're on the same paper a few times, where we've applied this thinking of preparation for future learning in simulation settings. And yeah, so there's some data out there already. Thank you for asking. I should have highlighted them from the get-go, but gotta do more of that self-promoting stuff, I guess. But yeah, we have done this, and we're basing it off of those prior works for sure. And yeah, I thought we could transition to this now, because this is actually my last slide. And so happy to answer other questions about the design or anything else that I brought up. But I also thought, as a group, having introduced some of these ideas to you and hopefully giving you some either new ways of thinking or new ways of thinking about how you've already been thinking about particular problems, how else might we better integrate simulation and workplace-based training so that we are creating a lifelong learning system? Right now we prepare people via sim. We give them these safe experiences. There's the ethical argument for why we do that away from patients. There's many rationales, but would you agree that it's a lifelong learning system? And if not, why not? If so, how so? And how might we continue to make it that kind of experience through, hopefully, ideas like this that I'm sharing with you today? So yeah, I just wanted to put that out there as a discussion for the group. So let's make it a yes, no, and then maybe people start to jump in on it. No, Lisa, yeah. Why don't you start us?
So I would say, within regards to the lifelong simulation, really important now, especially as we see all the changes in healthcare that are in front of us with regards to robotics, with regards to even the GBot and the communications and everything that's happening currently within simulation. If we don't always keep implementing it into all the new changes within healthcare, I think we'd be lost in training in a way that best suits our patient needs and our learner needs.
Yeah. And so how do we continually adapt? I agree. This is something that we always have to be on top of. Huddle.
Yeah, I think some disciplines are, have drank the Kool-Aid, are right out the gate. Nursing, the surgical, anesthesia professions, they all have figured out how to embed simulation into their training. But I think psychiatry is just waking up to the idea. And I think the CBD curriculum has helped somewhat in that we have to get EPAs for procedures like neurostimulation, ECT. So that's where we're hoping that we can get a foot in the door and get people revved up about coming down to the Sim Center for things like that. But again, if we could start early on and sort of wrap their minds around that simulation as a part and parcel of learning, then the CPD, we hope the CPD piece will fall in line and it'll become a lifelong pursuit.
Mm-hmm. That's great. And then the only thing I would argue there is then we have a really great opportunity not just to offer sessions that get people exposure or get them some experience. That's actually what led to this study. I sat down with Kieran McIntyre, who I've mentioned. He's a quality improvement expert and an expert in thoracentesis. He started a clinic that exclusively draws thoracentesis patients from other services because he's so good at it. And he said, no trainee I have ever seen is capable of participating in my clinic, so I have to do it all myself. I say, why is that? And he's like, because all the simulation training that I understand people get is just about exposing them to the procedure, not actually making them great at it. And he's like, and I was like, well, what if I design training that does make them prepared to learn with you and to perform effectively with you, that you would feel comfortable having them be by your side? And he's like, prove it, to show me. And so this is what we came up with. And so that I think is the call to action for us all. If we have these opportunities through EPAs or whatever initiative is getting more people coming through our sim centers, then how are we designing those sim experiences? Are we designing them to be about mastering the thing and not about learning? Or is it about both? The point that I'm trying to make is, let's think about both. We do want them to be good at whatever it is that the EPA requires, but we also have the opportunity to train them to be effective learners through these experiences. And wouldn't it be nice if we could accomplish both? And this is one way to think about it. Any other thoughts or questions? Ideas about how we can create this system, or is the system working in the way that we want it to, or how might we change it? Open to anything.
Maybe if this is your last slide, you could stop sharing so we could
Yeah,
see
great point. Thank you.
faces. Yeah.
Yeah, let's see each other. Thank you, Paddle. Are some of you doing this already? Is there anything that you're actually implementing now that you feel, oh, hey, this actually does fit? Or is there any changes you might make with some of these ideas? Not that I think I'm changing everything about your thinking you're doing, but is there anything where you're like, huh, maybe I'll try something a little bit differently now? Or is it 4:53 on a Thursday? Reality creeps in a little bit. I understand.
I'm not on mute. I think like I would like to see a little bit more efficacy with using Zoom, for instance, to do some simulation training of some sort, whereby you don't have to bring the numbers in that we are, and that maybe there's an opportunity for like a 24/7 practice opportunity or rental of equipment. I'm not sure if I'm drifting off here somewhere else outside of what you're thinking, but I think the ability for residents, especially in surgery, to train at home and all disciplines would be wonderful if it could be sort of monitored in some way, reported in some way. I don't know, but I think, work from home isn't just the only thing on the agenda for a lot of people, is do anything from home.
Yeah. And so, yeah, if people are willing to engage in, to set goals about this, whatever activity you put in front of them, etc., that is self-regulated learning. That is an opportunity for us to continually make these experiences challenging enough, authentic enough of what problem solving looks like in the real practice setting, that gives them these experiences. So I think, Lisa, this can happen anywhere. It doesn't just have to happen in the sim center. For us, the studies in the sim because it's a hands-on procedure, but there's so much more we could be teaching and across different modalities. So absolutely, I think that would fit.
And our last presenter for April talked about distance simulation, Lisa, for Pakistani physicians in terms of pediatric emergency medicine. So that you're not far off in terms of goals and using distance simulation. There's people thinking about these things too.
Definitely.
I have a question for you, Ryan. How has Adam's work on motivation sort of, because one of the things about the problem solving first is I wonder, in the frustration that you mentioned, whether that might influence motivation levels. So
Yeah.
Is that something you're going to be collecting data on in some of those and what you're recording? And is that something you're going to be thinking about as well? Because I think sometimes students get frustrated and then they lose the motivation and so on and so forth.
Yeah, it's a very common concern in these interventions. So thanks for raising it. Like, why would we make people struggle if that might make them shut down? And I gave examples that could happen, right? And so in this particular study, we are looking to see, so we're not measuring motivation nor like perceived competence in learning, which actually would interact to influence people's behaviors. Like if you feel like you're not going to accomplish your goals because I put you in a setting where you're going to fail, then that will be problematic for your future learning too, especially in the session, like when you work with the instructor and so on. So yes, that matters. No, we're not measuring it in this particular study, but we're looking at implications of that kind of frustration in what notes people take. Like, are they just giving up and not even writing anything? Are they sitting there staring at the simulator? Do they express a lot of frustration when they finally do get to talk to the instructor? So I think we'll pick up on it in those kinds of data sources. But yeah, it's an important point. If we see that happening regularly, then the question is the struggle worth it if people are going to check out? And that's something that we'll have to monitor. The evidence suggests that people get through it. Our experience with other studies suggests people realize, oh, this was about me making meaning and figuring it out for myself. And oh, that's what I'm gonna have to do in my practice. Like they start to connect those dots. But yeah, there's probably a line and we're going to be near it with some people. So it's an important point to raise, Jamie.
I wonder if it also depends on where learners are in their training. Like if they're in sort of that workplace setting already versus if they're at the very beginning of their training where it's more classroom based, and that tolerance, that might influence tolerance and motivation as well.
Yeah, very fair point. So we are looking at second and third year students. So we're going to look at get both of those types and look to stratify randomization so that they're equally exposed to both interventions. So yeah, that's something we can monitor. Thank you. Well,
Or take them right down
by
to the
saying,
wire.
you can change at least, 2, 5, 10 of the people you help to train, their answers to those initial questions I asked. Has anyone taught you to think about or take different approaches to learning? And has anyone assessed you in how you learn to learn? I think if we can move the bar on that, we can start to signal to people that lifelong learning matters, and it's something that can develop. It's not just assumed to be there. We all know there are people who are better at it than others. We see it in our daily practice. And so how might we affect that more? I'll leave you with that in the people we have the opportunity to make change with.
Thank you so much, Ryan. It was a wonderful presentation. We all learned a lot and appreciate your time. Join us on June 1st, 12 to 1 for our next SimCity rounds, where we will be discussing the standardized patient program at the Tammany Faculty of Medicine, their successes and challenges with Delon Pereira and Lorene Dobby. Thanks, everyone. Have a wonderful evening.
Great seeing you all. Thank you so much.